Okay. It is the 17th of January, 2024, 1:11 p.m., and we will call to order the special session for the Board of Trustees of the Christian County Health Department for our strategic planning session. Well, I know that's a little bit it's that clock is what I was looking at, but yeah, okay. We'll match.
Personally, I would recommend two things. One is that we put a limit on how long this meeting's going to go.
I have an appreciation for that because I've met me.
And number two is that we approve an agenda. What topics are we going to cover in what order so that we can end up with at least getting our highest priority.
Well, then we can also take the agenda if we need to have another special meeting.
Come back to it.
Instead of starting all over.
May I propose?
Absolutely.
Give everybody a copy of what I would like to, what I think is good read.
Oh, look at that.
Yeah.
Nimble.
Yeah, well, because as you can see, they're all over your topic. Right. Yeah.
One table for this color. The board secretary, and then Ron Lester, who was here yesterday, and Trevor, and then the board chair, we have Frederick, and Kathy Adams, she's on the list, and then Charlie, absent at the moment, but he's our vice chair.
Nice to meet everyone.
So what I did, and kind of to fill what Dennis said there, I made a little list just for mine. I didn't hand it out. I just made it for me, just so I had some notes. But I came back and I thought there was, there's about four things that I'd like to see us start strategically thinking about. One is our space. What we're going to do with our space, whether it be the First Street building or whatever building we have. Second is storage. I mean, what do we need for storage? What do we accomplish with that? Parking. What are we going to do for parking? And then what I would call mobility or onboard unit. I put down the word mobility. I don't know what to put down, but it's our outreach mobile, our outreach strategies into that. And then, like when I talked about, and I don't know if we just want to, maybe the subject would be to take 4 or 5 subjects, spend 15 minutes on each, get a few bullet points down, get through all of them once, and then we can determine which one's the highest priority to come back and say, what is the, what are our highest priorities? I think, I somewhat started this because, I'm concerned that we have a very expensive building for multiple years with no utilization, and that really doesn't speak highly, I don't believe, of using our assets properly. And if we're not going to use it, if we don't see a need for that building, then we should get rid of it and put the money in and use it, for other needs that we may have. So, maybe, and when I think of space, I'm just, I would, maybe the thing, do we spend 15 minutes on each subject to just get some bullet points down? That would be an hour. Spend the last 15, 20 minutes trying to prioritize and set next steps. That makes sense to you, Ken? An hour and a half, maybe recording.
An hour and a half looks for me.
I think that would give us, so I think it's quarter after right now. If we kind of, I put it like first with space in my mind is, what are we going to do with the space, the buildings we have? And I think that was kind of what I would put as the first 15-minute discussion. And I'm going to kind of just pick off a couple things here that, I think the remodeling is very sound and very good and well needed.
Tyler.
know if there's a lot of, I don't have the information in my mind at least to understand, is the space we have in the new one, I wrote down really three primary areas. We have emergency, we have WIC, and we have environmental. Are those set up properly? Do we have enough space for those in the future? Is this a 5-year, 10-year plan that we think we would have space, or is it a, hey, by the time we get this done, we're going to need more?
Yeah.
And I know we added more offices, a few, but, and I don't know what that real strategy was through that whole piece. I don't know if there was really a clear direction of what we were trying to accomplish. At least I've never seen one in a year and a half. I've been on the board saying, here's what we were trying to accomplish with the remodeling, and where our next step is. So, then I had, outside of space, and then I had, what I call extraordinary space needs, related to like a pandemic. If that occurs again, what are we going to need? How do we handle something like that? I really think training events is very important. Mm-hmm. That if we could have a space for, CPR training, I'm not a medical, so how about that in my letters? Is it AED or PED? AED, guys.
Yep.
I got it right. Second time I had to cross it off. But like environmental training, I know we're doing some of that on Wi-Fi right now, but I think really the ability to have a space for us to use is very important. Mm-hmm. And I also believe that there's the opportunity to use that for intergovernmental and be a good partner. I mean, in the long run, I'm not sure we need that space all the time, but that space over, of the old post office, this is brick, and that's what we call it. Church. I couldn't remember the church. The Church Street building, if we ever had something, a pandemic, that'd be very critical. I mean, we struggled big time. People that were doing the shots and involved, and Leah, you were some, Kathy, I'm not sure, I don't remember. I mean, a lot of us were there a lot. I mean, we were all over the community. And once we got this set up and kind of running, it worked fairly well. Mm-hmm. But, what is our ongoing space? And I know there's some concerns about intergovernmental. If we can share the space with the city needs it for some sort of meeting. And, I know with WIC, maybe we can, but I don't know if we're putting WIC in that building. Now, the storage part, to me, there's, and I think, when I think of it, there's the campus, the main campus. There's a storage facility on Church Street, and there's a meeting facility. So really, we have 3 facilities in my mind. And I think we should keep them separated as 3. Because we could build part of the storage in the Church Street storage building to WIC, at least
with their records. Yeah.
We can work to get back for space. But I don't know, we may be tied up if we're charging WIC for some of the space that we can't use it for other things. Yeah. So that if we would keep those couple buildings. But, I look at it, I look here and I'm not convinced I'm a big believer in WIC. Just, I really believe in helping children. And, if this building fills up, the most logical thing to move to the Church Street front building, in my eyes, would be WIC. And keep nursing and environmental. And we're going to do all that fancy environmental with the drive-up. Sure, they're not going to move it. Nursing, you do the nursing over there, you can move WIC over there. But to me, that would be a nice facility for freestanding WIC. If we need it. Yeah. And when we need it. Not yet. In my mind, it should be when. Yeah. Because if we do our jobs, we should have people clamoring to be involved in WIC.
Well, we know we greatly underestimate the people that are eligible to the people that are utilizing the service. Just comparing our Medicaid numbers for women with children for the county.
Part of the office support the nursing is from front desk, but it has its own.
They do, but we also mostly have those individuals, so if we were to see and then to go and take tests and things like that, it would become an issue. We might have to hire some more people to help us to keep all of the services going. Because even Connor, he's in the store, he's doing multiple things too. He's not just a marketing person, but he's learning how to do it and again. So it would be kind of difficult for those people to.
Yeah. But also,
Really be,
yeah.
we were making a 1-year strategic plan, a 3-year, maybe 5-year.
Yeah.
This would at least be a 3-year, maybe 5.
Yeah.
And it would be wholly dependent on the success of our recruiting of more people.
Mm-hmm.
I think that, we've got this very expensive mobile unit out there, and instead of as much in the building, I think that's where we're gonna hit.
Yeah.
That's where we're gonna hit
Well,
stuff.
Yeah.
I'm not as much concerned about expansion of risk as I am expansion of nursing.
Mm-hmm.
And if we expand nursing, where do we get the space for that? And, it's really all of them. But,
Yeah.
The nursing could, and I hear of Webster and some of these having, 7, 8, 9 nurses on staff.
Mm-hmm.
We struggle to have 3, 4, 5,
They do a lot. Webster does a lot of outreach. Like they go to the Amish communities, and they do a lot of. They do a lot of.
They would make use of mobile units.
Yeah, they're not, I wouldn't consider them very comparable to us, but to your point, I think it's a very high priority that we get out to the community more.
Yeah, I think to me that's my number one. Yeah, because we've got an expensive unit sitting out there that hasn't gotten used and is dead now because
Sorry.
Yay.
Didn't have to do anything, just
but we've got this, and I think we need to
Besides
as soon as possible.
WIC clinic type activities, intake, whatever we can do mobily once we get the internet issues resolved. What else can we do out of that mobile unit?
Immunization.
Yeah, we just have that immunizations. We're hoping to do some QPR training. It's for mental health.
Uh-huh.
And so maybe even take it to senior communities, take it to apartment complexes.
Mm-hmm.
Because we don't serve through this argument.
Yeah.
That's what
Yeah.
Mario's additional services.
We were talking about demographics the other day. The fastest growing group in Christian County is by far seniors.
I think it's just officer, clinics out of there, blue shots, pneumonia shots, things like that.
But when you say you're out of the mobile unit,
Mm-hmm.
is the mobile unit the transportation mode, and then another facility is utilized for the activity?
Maybe they could go to the senior center. You could take the mobile unit to the senior centers, and they could do those kinds of
But it
programs.
doesn't require the mobile unit for that. But whereas,
No, but I just think we're not serving. That's just.
And it's visibility too. Like when you see it out there,
Weather is nice there. We
Yeah.
could find some tents,
Uh-huh.
like bombings and things on them, so we could set those up outside the unit. And we could see a lot of people
Yeah.
there even, just even communicate with
I kind of see like our team being somewhat in the parking lot, taking people, but maybe they go into the senior care center for like using the restroom or while they wait. It should be pretty fluid, is what I would imagine with those partnerships. Yeah.
The things for the dedication kits,
Mhm.
those kinds of things that would be something that
promotional type items.
Yeah. would be great to have.
There's
Not senior care,
Yeah.
at the senior center.
There's a program through UMKC School of Pharmacy too called Is It Drugs or Is It Candy, where they do like education for young children and parents about safe medication storage. Because I'm telling you, you look at Norco 5325 and an Icebreaker cinnamon mist, and it is real hard to tell the difference between those two. And if you find it in mom's purse, it could be a really bad situation. So
what I'm saying is, I have a truck, I have a car, I have a tractor. I would not use the tractor or the truck just to run out.
Right.
So I don't want us using I don't think we should be using the van just for transportation.
No.
yeah,
But for events, yes.
Well, and I think, for example, there would be a senior center. I think Having that van up front with the.
It's a mobile billboard.
It's a mobile billboard, I think adds a lot of credence to it also, so.
But you would do there's lots of things that you could do at that time.
Yeah.
I think certification is really important.
We'll be able to make appointments from there too, because we're going to have to donate hopefully with the funds that we're getting to next year. And so they're going to take so we should be able to transfer directly from no matter where we're at to the health department.
Does it have refrigeration?
Yes.
Okay.
Is it CLIA waived? Would we be able to transport samples or draw?
The mobile unit?
Yeah.
I don't know much about a unit being clear waived, but we have clear waivers that we get through the state.
I think the unit itself has to be CLIA waived, but you can add it on as a site to the CLIA waiver.
Okay. We have.
Yeah, they have a special system for mobile CLIA stuff. On a side note, that's that's the licensure that allows you to carry and transport blood products, things that could be contagious. That source of blood-borne pathogens.
I mean, I think that's really good. I think the senior center, I think the opportunity to go down to what's the Christian County Food?
Lisa Bees.
Having that van out there and offering shots, flu shots, and other shots for people.
We're hoping to get a hemoglobin machine, a blood cholesterol machine, and a blood glucose machine.
Do you need help with that?
We're looking at some right now. We're just trying to figure out the patient.
Yeah, I've worked with a few in my time, so.
Maybe you can give us some ideas and thoughts on that. But we should charge the minimal amount to do this, maybe a health screening, because we're going to have a height board. The babies are going to measuring board for them because of that. And I think we're going to start hopefully in March or April. Where Congressman will come with a librarian in Florida, and then the rest of us working in the other libraries in St. Cloud and Minnesota too. But we're happy to work with them to see what the time frame or day of the week and time during the day.
Yeah.
Works with their schedule or the other things that they have going on.
Baby skills? Like mobile ones?
I don't think so. They have to be certified through it and what's approved, and I think we have all of those now. It's just first one.
You don't get that home visits. I was going to get rid of them, so.
Yeah. Don't get rid of them yet, because there may be the right we have one in each trailer, and we do have one for the moment.
So basically, that topic that we've been addressing is the utilization of the commodities.
Yeah.
So I think what I've heard here is that, we have kind of a somewhat start of a calendar saying by April, I was going to use the date 15th. And I think we need to kind of get some timelines down so we can track and see how we're achieving it, where we're heading. I think that is with the libraries and start working with it. I think we've heard that, the senior centers and how we can better facilitate with those. And
maybe not even just the senior centers, they could be at the high school parking lot or.
Wherever the senior, let's say the senior community.
Yeah.
And at least for these, I think is a very valuable opportunity. I mean, I think if we focused on those three, would they be, is there something we're missing?
Volunteers in medicine, they take their own in effort to produce the first Wednesday in the month, is that right?
But I think that would be ideal to have us both there at the same time.
Yeah.
Would we overlap at all in services?
What's that?
We have to make sure we don't overlap in services also.
But at least to start out with, to kind of get some exposure and see what's going on, or at least be there to see.
Well, if it's not, wouldn't be overlapping the services.
Yeah. But they do, I don't know, they may do.
From providing clinical services, where, for hire to do exactly on profitable doctor type stuff. They aren't, and that'd be their niche. Our niche is public health. But is this something that perhaps Congress should, start looking around to see what locations, especially south and west?
Yes, churches, we kind of talked about that. Churches, pharmacy, parking lots, maybe, his billing that we have a Florida community.
You'll laugh, I knew.
And then we've already covered up the Florida cover, so you've been in the church coming in.
That was our first 15 minutes.
I know several elderly people who live down near Forsyth. That's their address, even though it's in the next county.
Yes.
And there's nothing.
Also, Clever has nothing
Not much
out there.
for either of those.
That gets pulled in from billing those little areas out there.
But
They're
it's-
gonna call us, it's probably
Right.
5%.
And they have a library branch, don't they? Yeah.
even
Clever.
though the community center in Chadwick is open, but they it's ideas.
So what, if we're going to set a SMART goal with a specific date, we would want to see at least one per week happening by mid-April 2024. And forgive me, when is the election? It's April 2nd. Okay, so that would be, the new board could be sworn and kind of get those teeth wet.
Well, that would be, when would that happen?
It'd be at the first meeting for the first year.
15% cheap.
Yeah. Welcome. Please enforce this.
I think it would be great if we could walk out of this meeting and have a date like April 15th or April 1st, or whatever it may be, that we would, that's our goal, to start having it weekly. If we don't make it, at least we can track and see what our challenges and opportunities are.
Create a scorecard.
Yeah, scorecard of what we're doing and
And we have a little bit of a challenge, and I can't remember what we have on our approval, but we can't just take what's anywhere. So we have to get approval from the state based on needs, and they tell us, they let us know how many days that we can actually go out there and try it. So if we want to get to a different site, if we go, the site that we started at is not working, then we'll have to let them know that, go through the paperwork approval process, and then try a different site. But
Is there, can you do that preemptively? Like, if we know we want Clever, Sparta? Okay.
I don't think we're gonna, we tried, to ask them for 2 or 3 sites, but they told us we have to start in one. And it's a new process for us as well. James is doing it, but they're taking their mobile unit more into helping us, the locales that are in Spain. And so they're kind of tracking the population. When that population has to move to another movement, they take their mobile unit, because they're the only county that states running do that at this point because they're unique.
we reached out to Western people that have mobile units and what they're doing. Is something we're missing that you heard?
I'd like to have comment to kind of look around too, so I don't know if we found anything.
Yeah, I haven't formally reached out to them. A lot of what has been said, I've observed, like specifically with Webster, they do go to senior facilities like every second and fourth Tuesday of the month, and I think they do that with a high school in that county, and so they have a very much like we're at the same place every month, like on the same days, in case people can't come on a certain day or whatever. So
I think that's really important.
from what I've seen, it's been general health checkups and access to like resources and kits and stuff like that. And I haven't done a lot of research yet, but that's just been my, I guess, surface observation so far.
I know they do the nurses do, yes. Well, no, just for the elderly, I mean, they can't necessarily always be, and they do quite a few, and it's a nurse that does it, but, I know that Nixa had it, and they lost theirs. Ozark had it, the one retired, and the new one they're still in, and so she's only doing it like it's once a week.
Yeah.
But they're full.
There was a waiting list for a bunch of.
Yeah.
one of the counties too was doing some sort of a food pantry. I mean, I don't know if we could even collect something in non-perishables to even donate those to these, so that we would have that partnership with them as well. We wouldn't want to show up over here with that stuff, but if we could collect things while we're out. And
well, I think that's a good thing, starting with them maybe on their parking lot, that, you know, you'll soon, and I think we'll identify some of the needs, you know, hey, pull out, put a little sign in front, or I don't even know if they're getting out of their cars anymore. They weren't for a long time because of COVID. They were staying in, but I know some people that volunteer there, and you know, they're growing tremendously. I mean, I think there's obviously the opportunity for flu shots or, you know, other shots, immunizations we could give on that premise would probably help a lot of people.
Yeah.
But it's not going to start day one. I mean, you're going to pull in there and have to see you there and start. And to the point, you can't just go, well, we'll be there maybe again sometime soon.
What's your idea on marketing? How will you get this information out to the public?
I think a big part of it is just communicating with wherever we're going to go to make sure wherever that is that they are telling the people already there that Health Farm is going to be there this day, along with, you know, the other stuff that I'm trying to do, along with like social media and getting people to actually see our social posts and connect with them more so that they can, you know, get that information from the source. But I think starting out, probably the biggest thing is just making sure if we are going to be at the Sparta Library, that the Sparta Library is telling people, hey, they're going to be here today.
Do you think that that's only reaching the people that use the library then?
Yeah, but that's sort of where repeat and consistency comes in. If you get word of mouth started in the community, and hopefully you can be like, oh yeah, no, I got my WIC reloaded when I came to the library, and now I think I'm to the library. So, yeah.
Coming here, getting them, and then they were going out into the community saying, look what I got. And they're like, where did you get that? And then we would have people come in, just pouring in here, wanting, look what I got this emergency or safety kit from you. Can I get one of those? And so we were handing those out in candy.
Media now spreads very quickly because you get the message and you send it to all your friends, and then they send it to all their friends, which is faster than missionary work.
I think we're getting close to getting the mobile app running too. We finally just, it's taken a couple of weeks to work with Apple developers, but this morning we finally did get through, so now we're waiting on our kickoff call with the app developers, so that should be coming interesting.
I think part of that too is, you know, there's a way on like Facebook and social media that
make events.
Put information in, and you put a campaign on it, you put something to try to get them excited. You want to see how much response you get to that. And if no one is clicking, then we're reaching the wrong direction. And we need to change our approach and how we can work to get that. And I know where I previously worked, but I mean, constantly we want to know how many clicks we were getting off of things, and you know what changed their emotion, what made them do something different. So
I started doing some of that already.
But that's very important. I mean,
Absolutely.
so like if we partnered with Lisa V's, we would definitely ask them to put it on their website. We have 3,000 followers, I think you said.
Last I checked is 3.9 thousand.
So right about 4,000. Maybe they got 15,000. So suddenly now we're starting to, and can we get them a clickbait if you're interested, have something there, click there if you're interested and see our services. If we see that click, then we know we're aiming at the right spots. And if you don't give them something to react to, you don't know if you're reaching them. So you need to try to figure out a way to get them to click.
And from my conversations around the county, people they feel like things like the health department and even the courthouse and everything else, it's all remembered.
Mm-hmm.
Yeah. And so our emphasis really should be further out than Lisa V's. So, and I think that's where we'll have to
But Lisa V's is just making sure I remember correctly, that's the county food pantry, not just the city. Like, it's in Ozark also, but yeah. So, I mean, that may be their location, but it would still potentially reach further than that.
In certain ways, I think we're used to these, but definitely, maybe not, but definitely in other aspects, senior centers, stuff like that, absolutely getting out.
So, we will need some sort of criteria developed on like what does a successful outreach look like? Is it number of people? Is it, I don't know, number of clicks? Does it generate traffic? I don't know. So,
kind of a
yeah.
work in progress, so.
Yeah, but we won't be able to know if it, like you build with the end in mind. So I want to make sure that we have a way to ensure that not only are we using these expensive resources, which is a great step forward, but we're using them effectively.
I would suggest also we use signs and placards as well as social media.
Or like,
But we can certainly put signs in the grocery.
and banners, flyers.
They always have stuff about a circus coming to town or
Or a mailer.
Those are pricey. Direct mail is ends up costing you
Somebody's spending way too much money on it.
No kidding. You can't stop it. So anyway, I would also, another thing, I would like to see us review a monthly report on how the outreach is going. Just a quick word. We don't need, but quarterly or maybe semi-annually, we look at that and see what our trend is. And I'm sure that's something you can generate with a few clicks.
Yeah, I actually just yesterday was looking at the back end of Facebook with it, and so I think along with whenever I have my marketing report, I'm going to start including some info like that. Like from looking at it yesterday, it includes information on like clicks, number of people that have shared, the amount of people that have seen it, period, whether they just ignored it or not. And so yeah, that's definitely something that I will be presenting.
And that's the key. So how well we're doing is the more you see us sharing, the more you see us clicking, the more. And and there's not an easy answer to say, oh, you do this. Well, there is one chance. You give everybody $1,000 if they click, but I don't think we can afford that. So we have kind of a somewhat random ability for the meeting. So I think, are we saying that we're going to try to develop using an April 15th kind of a weekly outreach on a weekly basis for the unit?
Do you feel like April 15th is a reasonable time frame, Connor, for the person that we're asking probably to take on the lion's share there?
He's got a lot of things he's trying to accomplish. The building has been pretty huge. He's trying to get our Facebook pages. We had a list at a health department Facebook page, so he's trying to get those.
Like those links, pages.
Links, what did we do, connector? I can't remember what we did.
Merged the link page had I think like 190 people following it and was last touched over a year ago. So now it's just the health department page and that info is going to be shared there. So it's not splitting up the people that are actually listening to us into two separate places.
Let me recap what I wrote as notes here and see if it jives with what everybody's thinking. We need to get out to the community more. That's going to involve considerations for staff, programs, use of the van, events, immunizations, which our goal is to have a weekly presence of what services, and then review it in a periodic report. Utilize also advertising, standard advertising like the times and prices. Everything I wrote down.
I think if you did it like I think Ron said, where you could stay on the second and fourth, Tuesday will be here, and if you have designated times instead of, then that's when you're going to start to get your familiarity.
It's going to start very slow.
Yeah, instead of just, okay, we're gonna be start on this day and then we'll be clever here and then they don't really know where you're gonna be at. But if you have something that's set.
Yeah.
You're saying for recurring?
And, yeah, recurring where
We're at least to these the second Tuesday of every month.
yeah, we're at the senior center on the
Third Tuesday of every month.
yeah.
Yeah. I think that's very important. And, we have to.
Or even twice, you second and fourth.
See what the demand comes.
First and third.
Yeah.
For your week, weekly especially where you can say, first and third and maybe you got first and third for like the WIC stuff and second and fourth for senior centers and other ones for the getting the kids.
So if we covered that, I would like to also consider this survey that's coming up, because that is time limited. And, even before the company starts work, we need to get them, make sure they've got pretty clear direction, on our desires. I know he is our liaison, but, what do we want? Is there something we really want to glean from it? And I haven't heard that articulated yet. And I think it's a handicap to the company if we don't tell them what we want to find out. Otherwise, they're going to say, here's your demographics, and we ask these questions. So, I understand from what you said the other day, Leah, that services that we already provide, it's an awareness thing.
Or access. They could be aware of it but unable to access it, and that would still be a failure that would need to be identified.
We don't need to ask them if they approve of it or disapprove of it. We don't need to ask any kind of questions that rate.
Like a lighter scale.
Yeah.
Right.
More of a
So,
awareness.
is the awareness maybe one of our priorities? Do we want to know what could we do better in order to run storytelling?
Yeah, I'd be interested in, do they really understand what services we're providing? Are they able to achieve our services like county services? How do we reach out better to them? What are their expectations? Yeah, and they want to say, but it's really, to me, I think the first one is going to be a learning. So I think we just have pretty basic, and really then understand when it comes back, we're going to see, they really believe that, we need to be more out of the county.
Yeah.
They really believe, that, I wasn't aware of these services, so how do we improve that?
You could be like, with the following describes your understanding of the water testing services from the Christian County Environmental Department. I didn't know, and I don't use it. I didn't know, but I will use it. I know, I don't use it. We could kind of piece some of those together.
Yeah, I don't, like WIC, I think it's a big one. How many people, do you use Christian County? It's only going to go to our residents, or do you use a facility in a different county? There's how much of that, how much do you even know that it's available? I don't know how to ask it because I'm not the medical guy. But I think the basic thing, in my eyes, to start with is more around, do they know what services we offer? Are they available, or what's their feelings about, the ease of getting those services, accessing those services, good word. And I couldn't get that, but I think that's a lot of them to begin with. You need to come back and say, boy, it's all access. We get, everything else we're, 1 to 10, let's say, but everything else we get 6s and 8s and 7s.
I think a lot of it is them.
Yeah.
I do too.
And that's one of the things he recommended is addressing communication preferences. so that once we figure out the best way, is it Facebook, is it an app, is it flyers, is it educational events at small venues, whatever that comes back as.
Yeah, because my wife is an ex-consultant, she isn't eligible for any kind of insurance here, so when she goes to get immunizations, when we arrived here, or she arrived here, I wasn't aware that she could, now she's a legal permanent resident, could she come here and get immunizations? I didn't even know. We called and we found out we could. She got her immunization that she wanted. So,
Let's say, I suspected that would be the case, but I was interested to find out. When we did the COVID vaccines, they originally required citizenship, but then they took that away, and they're like, just don't screen for it. Whoever shows up with an arm, do it. It'd be interesting if they had different standards for...
I don't think even people in the community who have a negative impression of the health department understand.
Yeah. What we do. Yeah.
And
it's easy to be angry and misinformed. You know, when you think about the safe food that you eat and the water that you enjoy drinking, that becomes a little bit different picture. Yeah, so.
Okay, so I put down, make sure they understand that we want to know how well people comprehend our programs and our services, how well they access. What is their desire, if they have a desire that we're not satisfying?
That's what I'm wondering, how do you do that?
Well, one thing that and he did point this out, I kind of discussed it a little bit with him, how often do we do is it every 3 years we do the community needs assessment with the other counties in our area?
It was every 5, because we've been working with the hospital station and every 3. So it's been done every 3 months.
So, not that it's resident specific, but we do have another source of information.
Have you looked at the questionnaire? I just recently did, and a lot of stuff on there is just like, it's either inapplicable. A lot of it targets toward women's health. You know, when did you have your last pap smear, and you know, have you ever had cancer? And so I guess it's a good overview of what's going on in the county, but result-wise, there's a lot of people who refuse to answer questions. So it was like 21% refused to answer that question. And so, you know, what we're doing, I think, is head and shoulders above the regular, because that's just looking for chronic diseases.
Well, sort of. I mean, like, one of the things that it found that I thought was interesting when we were looking, like, at the COP strategic plan, they wanted to match their efforts to some of those needs, and addiction services was way up on the list, which we don't have great resources here in this area for. So, you know, I think you could find what you're looking for, but I want, like, what do you want to find?
Well,
is it, like, if we get 20 questions and we have a surrogate overview of the area's healthcare, like, needs, do we want to spend those 20 questions asking it again, maybe better, admittedly better, or more in line with our community as a rural county with some suburban sprawl versus Greene County, who's going to have a more urban standpoint. But I do know they pool that with other rural counties too, so it's not overwhelming.
Rural health section does their own. Okay.
Are you talking about from the health department standpoint?
Right.
We did, and it was very costly and very time consuming, and we didn't get very many very good individuals to help us with this community assessment. So it wasn't very accurate.
Okay. That's the last one that I read.
Yeah.
The last one that we did last year arose in 2020. Maybe it was finished. It was about a year and a half, 2 years. It was going on during the pandemic. But yeah, and Connor's been on some of those meetings now too with the other health departments and hospital associations. So, and Joplin City did that to their area. So it's mapped out around the hospitals. That's how it is. That's why we're in a Springfield community, because we're with the hospital, Springfield Community Hospital. Since we were to do our own community assessment, that's where we gather our information, because that's where citizens have to go to get their health care. And so we've been taking into the lab assessment. I just Charlotte here to that note. And they did one probably 4 or 5 years before I came here, and it was very time consuming, very costly, and not accurate. So we felt like it was probably better to go ahead and go where it's free, where there's a lot of people from different areas are putting this information together so that it's not too time consuming.
So, but is there a way that, you said 20 questions is what they're
recommending. The more that you get, and like you said with that, the more you get, the more likely people are going to abandon it. You know, I don't have time for this.
Yeah.
And
so is there a way that they can identify needs that are not being
one of the things that we could potentially do is make one question, how important is this issue to you? And then be like, you know, substance abuse and treatment, nutrition, like adequate nutrition, diabetes, you know, safe healthcare education availability, and then pick like most important, not important. Yeah.
Then you can, how many are we going to have? How many, you think there's about 2,000 responses?
400.
400.
But they do structure that 400 based on the census data, so all that has, well, that was like his max. He was like, if you send out more than that, you're gonna...
Yeah, but they finish up always with 5
demographics. Yeah.
And so you only really get 15.
But you have to have the demographic questions to validate the population response. I know.
I mean, that's, so when are we, timing-wise, we're still looking for in the first quarter?
Yeah. I mean, my plan was to by end of week have a draft back to Robert for him to give feedback on, and hopefully by the end of the month have like an approved survey. You want CC'd on that? He's been decent to work with.
Yeah, maybe next year Connor can make a Google survey.
Well, and that's another thing is that this is the paid, like validated results. But we can create a form that citizens can go and notify us about, and we can work to increase awareness of that resource. That's free. We get to see it directly. That would be something, that we could future plan on.
You can entice them with substance. I
can find you some doodads.
So Karen, would it be possible in the next 30, 40 days to give us a kind of what you sense our space situation is going forward? I mean, I think that's very important for this building over here. I mean, do we feel going forward that we have the next 5 years covered, 10 years, or do you think, are we gonna, when we get the remodeling done, we're full of the first day?
When we get the remodeling done, I think we will be good for 3 to 5 years for sure. Especially, with the staffing that we have, it's
well, the county's growing 20%.
Mm-hmm.
Yeah.
Well, not only is the county growing, we are hoping to grow too. So, I mean, it depends on, buy-in from the communities and how well our outreach goes. And that's when.
And we only had 1.5 nurses in, so this entire time that's what we've had. And so, in our case, we would have somebody coming in North Pass and they'd like to do our nurses down. But even though our county has continued to grow, we haven't really had a big influx of people coming in to help us. Again, maybe because of the lack of awareness, I don't know. But I guess with the populations changing as well, you know.
Well, I mean, as we're trying to grow the health department, make our services very well known. Hopefully that will bring in additional residents, wanting services. And how do we, now is the mobile unit going to take up 30% of that? Because we're going to be out doing it in the field? Is it,
yeah, that's true.
All going to work?
I think for another unit, it's also better than this. I think that's
Maybe ease some of the.
To us over and over again, provision for why and what was needed, and when she presented it, and each time it come back, it looked like a good 5-year idea, a plan. So, I don't think we're going to be behind the power curve. 5 years from now, yeah, maybe we'll have to be looking at something.
Well, and I'm just more concerned about this building over here. I mean, what do we do with it? Long term, short term? Is it worth, I mean, that building probably worth $750,000.
My opinion, the storage part needs to stay, and just because
Well, I
you
think-
need to have that.
I think that's a very valid point, and that's why I have storage down here, because we can get rid of the front part of the Church Street building, but that building, our storage building, there's no storage, a lot of storage within this building. And I walk over there and just walk through it. There's a lot of stuff that could go out. Don't get me wrong, there's a bunch of old file cabinets. And I think we would say the people that are coming to look at the furniture could look at a few file cabinets if they wanted to.
Yeah.
They're empty and staying over there. It looks like they've been there a long time, but I'm not at all in favor of getting rid of that building. I'm in favor, if we're going to keep it, we do something with it, and we just don't let it sit there and deteriorate.
My goal was to have it as a mini emergency response building, which is what we needed whenever I came. It was the mold infested. We're going to do mold remediation on it. The roof was leaking. We were using big outbursts to try to bring people in here and to do contract tracing for us for COVID and to get immunizations where we have to go for until we got that building at least to a point where we could get in it and it was safe. But the large space over there, if we could keep it open, to me it would be beneficial. We could potentially put one somewhere.
Well, it does give us an option. We're going to be landlocked when we're done with this.
Yeah.
So then that is our next resource to go to.
Yeah.
In my mind. And I realize it isn't the best, not being all in one building, but at least they're not across town.
Well, and I've been opposed to the mobile unit, but with this in mind, the mobile unit is a way of us not having to build a new building on Highway 14 or somewhere else. Because even then, the people from Rogersville are going to complain that the health department's too far away.
Yeah.
So, it has evolved in my thoughts about that.
Yeah.
But I want to make a comment directly related to that property, and that is, we need to seriously consider garaging when we have vehicles of that kind of
Caliber,
expense and stuff inside of it, and potential for vandalism.
For security and special needs. What security do we need on those? What special needs?
So I wouldn't get rid of that property even if we were to build carports. So
yeah, the landlocked status makes it unwise to sacrifice that.
Right. So I'm looking.
Parking standards just over there.
Well, and we started here, but they do have a plan for Church Street to expand and freshen up and add parking and.
I'm just concerned. This project is went on way too long.
We can still use that building just like we did if you have another pandemic. It's still usable.
It's my belief for a reasonably small amount of money. We could do the bathrooms enough to get them
up to code and
put paint on the outside. I mean, we don't need to do $500,000 upgrade to that building at this point. What I'm saying is do something that, have it be, if we wanted to do AED training, if we wanted to do, some of these things, we've got a facility that's over there.
And increasing the public's education on health is in the mission statement. So like, not only does it serve the emergency response goals, not only does it serve the potential to have, expanded capabilities for work in the future, we've got a place that we can still utilize for educational courses for our residents. And it is far away, but it's also, maybe we record it and put a Zoom link up. I don't know.
Yeah, I it would be, I just think we're going to sit here, anyone that believes that this remodeling is going to be done this year is, it will not be completed this year. It's just too long. Even when we, so again, now we're looking, well, maybe mid next year, and then, we'll start that building, we'll get it done in 27. And I just wish we could come up with a way to invest a small amount, a reasonable amount of money in that building to bring it up to a level that we can utilize it for other functions.
How much are you thinking?
I think for 150, you could do a tremendous job. Put a top ceiling in. So what the plan was, my understanding is those walls in that building, the front part of the building, are not load bearing. Freestanding, that is still being great. Take those walls out, put a drop ceiling in, tile it or carpet it with some sort of flooring, and do what we can do in that.
I think you'll have to do some electrical work over there.
Yeah, there'll be some electrical. But I think it's
And we know there's some kind of HVAC issue going on.
Well, that's fixed now, isn't it?
It is right now. Yeah, we have rainy furnaces over there, but we've had trouble with them.
Lots of trouble.
They're brand new.
Right, but they've never been up to par.
No, probably not, because we thought they would be.
I'm just hoping, I guess what I'm trying to hope for here is that we don't wait until we get this all done before we even start thinking about that. I just think, and partially, you can't do a lot until we know what this one's going to cost. And
I'm not in agreement of sitting around and waiting for another pandemic. That's not my vision on that thing at all. Because I don't believe it will happen on my time.
It doesn't need ADA compliant. I think open space would be good because we could do multiple things out of it. If we needed it to set up those 25, 30 office spaces because we need to call people again from a call center, we would have that opportunity to do that. Our wastewater is online now, but maybe that doesn't work out. We could obviously go back there.
Still have once a quarter meeting or once a year, where they come in.
We are trying to get staff. I asked at the last meeting who was interested in doing CPR training, so we've got 4, maybe 5 people. Just going to start going to do that, so as soon as we can get settled a little bit more, so we can get people out there.
The new Blackberry boardroom that goes, that's not, is it 50% bigger than this?
It's twice as big as this.
So, but that's for the bowels of the building. If we ever had to do pandemic or shops or, that would be very difficult to bring people into it.
Generally, as the work goes to the outside, to the parking lot, it's not going to be accessible to schools to come in. If you could let people in there if you needed to.
We could flush them out.
Yeah, but they're not going to have an opportunity to go back there to walk into the building.
Well, I guess the thing I want to get on the strategic plan that is on there and the progression to make sure, and that, this is like we're really have a huge investment with storing stuff. Right?
I think everyone's just feeling we're stagnant at everything, at the building, that's what I'm getting out of all this.
Yeah. Something's got to move.
The church space, the mobile unit, we just show up there every month.
I think we need that half hand to be in here every month.
Or at least in some kind of update where we can, yeah.
It's just like, we think.
Take them alive.
Yeah, and it's imperative to get this going. We understand there were delays with bids, and we understand that the holidays and weather and whatever, but
there will always be.
there will always be something. So I expect.
We definitely don't feel like we're priority.
Yeah.
By any means.
I think that would be reasonable to communicate to him.
How much square footage do you think is necessary for the essential public health tools and equipment over there?
Are you talking about the storage stuff? Or
Stuff that is in storage for public health emergencies.
Well, we've got the radio over there.
Because the same as a lot of the stuff happens towards into both trailers, so we still have stuff in the storage that's not fit in the trailers just yet. But, like 2 generators, I don't remember. There's been a lot of things.
I mean, I would walk through it. There's filing cabinets, and I don't know what's those are all. I think it's like
Your guess is as good as mine. You can on my table, I have a big bag of keys, but we have no idea what anything is.
You want me to break into it?
your idea. That building, 75%.
Well, the way it's done tonight.
In the back part. I don't know what's in the front part. Couldn't get in the front door.
Yeah, so the current building right now, except in the little kitchen area, we're going to rope it off, but those are the things that we plan on keeping. And everything else in the front part of that building, all about the boxes of gowns and equipment and anything that's left over there can probably be sold. I will have to.
Is the little blue cases, right?
Those are rest teams.
Okay, I've seen those.
And they won't let us get rid of
But
them.
that's about,
That's why they're paying storage. They're supposed to be paying storage over there. They have not been paying.
The other thing too is like not ideal, but in the event that we do have a public health emergency and we need to access those, do we have a contact for a storage unit that we could shove stuff in and clear out some extra needed space? Could that be kind of part of a contingency? We're gonna go put it in Jim's barn. It's an emergency, dang it.
Put the carpet down.
Okay, fair.
It used to be that there was mold on the front side, and so they sealed off the back side, so the mold.
You can't get through the doors.
Yeah, and so they. But I guess years ago, or through the years, the health department branched and had multiple storage units throughout the community, and that was not working out. And for all I know, there could be still some out there that I didn't even know about.
Storage wars. Gonna show up with
storage sales.
Yeah, but there's space over there to build a garage.
We were going to put a big parking lot.
Yeah.
That's one thing I thought, that I had down parking for the client, the staff, which I think we have that, pretty much covered with this building, but the one in the back now will be better. But then I had for our vehicles, I said 6, what are our security, what are our special needs? Because that mobile unit could be plugged in at all times so that you have it ready to go.
What would be nice is we did have the garage there because we did not have a drive-through facility figure in addition to that. Some of the health departments have been building like garages that have a front and back opening for ambulance cars.
Go right on through.
And then we could have a drive-through. I mean, that would be another option for a drive-through vaccine clinic.
But definitely, as Ken said, I think even the ability to just have a parking lot for our 6 vehicles that has some sort of a gate on it, not necessarily an empty just, and it does need to be totally fenced, but at least a gate that could be closed for some, a little bit. Good news is
But in the garage.
Yeah,
That's
true.
Then you could do that. If you handle it like that, you could have a shower in it.
Garages we get
That's pricier.
very pricey. But to your point, it may be worth it. I mean, I'm not saying against it.
At least for the mobile unit.
I think even just having, as Ken said, just a roof, roof system that you can park all of them under roofs so they're hail protected, just out of the sun, stuff like that. But I think, I agree that there's something.
The trailers.
I mean, to me, it would be nice to have an 8-stall parking where here's our trailers, here's our truck, there's a unit. It's secure to some extent, and they can, if you get a call where you hook up and you're right out the door and go. instead of that parking, you know. To me, that's almost more important than, I mean, the plans were pretty elaborate for building that up, and I think we could scale them back to just bare, you know, not bare minimums, but I don't think we need much more than just an open space with a drop ceiling and, you know, restrooms, and that's it. Yeah. I agree. It's just something that if it came about, or I really gotta look at the city of Nixa or Ozark, you know, with their courthouse and, you know, their municipal, I mean, just where do they ever have a meeting at if they could have more than, I mean, you know, I don't know if we could use that building to offer it to other governmental agencies, but I sure hope we could.
They're building a brand new campus now.
Yeah.
That's the county.
They use DOT as a conference area. So does the Chamber of Commerce.
So what do you want to do on this stage? I think the first thing we said is get monthly updates from the architect, and really I think it's fair to say that we are concerned about the pace and to make that.
That's their priority. Yeah.
Secondly, I think what I'm hearing is that we feel like we have 5 years that we're covered for the next 3 to 5 years, barring any huge growth in our minds right now. So the need for that building more so right now would be storage,
parking, education,
and some sort of a minimal
meeting,
special needs facility.
Emergency preparedness.
I heard you also say you would like to, in very short order, come up with a plan to renovate.
Yes.
Even as the other ones.
Yeah, we got some good traction.
I mean, you can hire, this is a major structural.
Right. That's a little bit more of a refresh.
Probably doesn't need all of
Paint.
it.
An architect may not. Yeah.
Come in and.
I mean, we're probably due just for legal.
I think we need it just for a base plan.
Yeah.
But then it's just a matter of going out and getting.
But bidding and contracting and things that they see about the day happening.
Yeah, Karen made a very good point. It has to be it's an ADA compliant, just because it's public.
Yeah, I mean, and yes, the restrooms need to be redone. But outside of that, electrical needs to be looked at, and who knows what all.
Automatic doors like we have here for handicap accessible and things.
Yeah, I mean, the front entrance. I don't know if you
need automatic doors unless it's going to be frequented by people with disabilities. And someone is present in order to open the door for them.
Yeah, well, that would be. I would like to see us, develop a strategy to move that building forward. I would hope by the end of the year we should at least have it in process or well on the way.
Yeah.
I mean, I think we're all in agreement we don't need anything fancy over it.
Yeah.
We want, but the senator and just not do anything with it.
Right.
It's not nothing.
Yeah.
It is still storage.
Yeah.
Storage for that.
And extra parking. Yeah. Yeah.
Well, I think it's two separate communities.
Yeah. Building. Yeah. It has multiple uses, but I sort of see it as one structure too.
And maybe it just becomes, if it's just going to become a full storage building, I don't think we need that much to put a little junk in, but that will happen. The more storage you get, the more storage you're going to have.
Yep.
More zombies yet.
Open up that door and make it parking for our van.
That would be nice.
Garage door.
We can make it just into a, like you say, a fire station, where you
Fire station.
can pull in.
The public health emergency.
Okay. Where are we with our timing?
I gave up.
Well,
We keep jumping around on topic, so yeah.
Outreach, the survey, and state.
and have parking.
Well, we kind of talked about parking, and we talked about the value of the
And I think we already talked about the full furniture, we talked about that yesterday.
We approved that we would offer it to the Christian County.
Yeah, I will reach out. I haven't had time yet, but I will.
I would say, I think we're saying any excess furniture we have.
Mm-hmm.
I will have a check through about there's 25 chairs over there. I know we're bought with the chairs out of 20 from COVID, and I don't know if we're required to keep those.
I understand.
Because you don't want to get rid of those chairs over there anyway, that would be for the class.
Are we talking about folding chairs over there?
We're getting folding chairs, we're getting tables and chairs, but I don't remember, I don't think I got, like the rolling nice, executive chairs, which is what we used for the COVID pandemic. I bought 25 small tables, 25 nicer chairs for them to sit in so they have their own workstation. But those things, you're going to see those are piled up on the website. But again, I don't know if you spend money to get rid of them. I don't think I can do that.
But you're going to keep stuff like that. They're going to keep that anyway for if you do have classes over there and stuff like that. Right?
We're getting new contracts. Yeah, but they're not going to be rolling chairs. They're going to be like people like this stuff do hold up what we can do, a little bit easier and then the harder chairs. But again, if we do hold up,
they're on top of what there are over there. Or over there.
Yeah. But we didn't want to use the roller chairs because it's a safety issue for one for community. But we will need those on the tables if we have another pandemic or some kind of emergency response where we need to call for them. We'll already have those things because the chairs don't float very easy, but the tables will.
The chairs are way cheaper to buy than the table, so if we had to replace those in a hurry, that shouldn't be.
Yeah, the problem you're talking about is disposition. You know, we have to store them for what?
Yeah, I don't know, because again, they're paid for by the federal government money through COVID.
And not really put in a bus.
Address to Washington, D.C.
Together, they didn't come put together. We had nothing. We started with nothing.
I think, Karen, what I'm talking about is those like Black Falcons, these big 3-foot wide, 4 or 5 foot tall.
Yeah.
Many of them just sitting there empty, just filling up space.
Yeah.
And I don't know what those are, the ones that are locked. You've never even been in them since you've been here. So they can't be too, I don't know what the records is that we have to keep.
Yeah.
I thought we were taking all our records from all the time.
Well, we haven't been able to do that. We've got it extended for one thing.
Every time the contract.
So, and the time frame for each thing is different, so we're still trying to figure that out. We were going to partner with the state, what are they called, the archives, like the state, and get a grant, but then we missed the grant last year, and I can't remember what total happened this year, so we're not going to get that money. And I don't know how many thousands of environmental health records that we have on file, but that is our goal to eventually take them to electronic format. As we get to our QRMD electronic health record system, the medical records we can for sure put over there. We might be able to move the environmental health records there too, but we just don't know what all that system is.
They're all existing.
Yeah.
So we don't know what's happening.
There's a lot of financial reports, is my understanding. I don't know. They were all moved over there before I came. And so, I
mean, there isn't, as you said, there's not a lot of emergency preparedness.
So that would be actually, we just need to inventory what's over there.
Yeah.
And if we come up with an inventory file of what's over there and what can be gotten rid of, I think we can have a much better handle on it.
Yeah, we're getting close to doing that because we've been moving the things that we know need to be sold to the front of the building because we know the furniture is going to go over into, and then like either have an auction or local auctioneer over there maybe, or maybe marketplace, you don't know. What do you else think? But yeah, once we get everything situated, because WIC has to have 1/4 of that storage space in the back in order for us to charge to that in-kind money this year. which is something we can do that. So that has to be kept separate. So 3/4 of it's going to be like a CCHC contract. You have to buy things that we're handing out for staff boards who's going to be over there. That, which is the public health emergency response part of 9 of January. It's still over there, but there's going to be a section that says that, and so those are for emergency response.
So what is how much square footage is that over there for storage? Or what? The area that you're talking about in which is how much?
I'll have to go back and think. It's been a couple months since I did that, but it's just a great portion. Is all that they're going to let us do a percentage off, and it was, I said, can I just take 1/4 of that, and they still let me do that.
I would guess it's probably about 10,000 square foot back.
The whole place.
It's the great building itself. It's just
Probably
great.
about 45, 50.
No, I'm saying, so the whole space in the gray building is 2,500 somewhere, and a fourth of that belongs to
Great.
Wind.
Yeah,
So
they're
there's
paying that.
750 square feet there now. Okay.
I would say those two buildings are fairly similar in size, with the old post office, the main building is slightly larger.
So the front side may be larger, but
Yeah, just slightly. They're fairly similar in size.
yeah.
Okay. Well, we got 4 minutes on our hour and a half. We're going to take a long way.
We actually have a little bit longer than that. We started 5 minutes in.
Sorry.
Yeah.
Starting from
Yeah. Oh, well, I padded it. But this says we've been talking for an hour and 16 minutes, and I gave 5 minutes for intros and coming up with the agenda, so.
Well, I don't have anything else.
I think this is a really good start. Hopefully it'll be the push we need on that renovations and get going, and we're very excited to hear what can be done with the mobile unit and outreach, so.
So I'm going to reach out to the architect and then honor expectations and make maybe first reach out to senior people and take them along and help us decide maybe.
I'd ask too if, depending on what resources are available from the health department, is there something you'd like to see in your community with this event? So Libby at the pharmacy in Sparta may be more interested in drug take-back or safe drug destruction than the library in Clutter, and maybe we could partner some with our community resources there too.
Yeah, we thought we would find the medication and stuff for kids. I think we can get those for free and maybe talk with one or.
There are buckets full, like an entire closet full at probably some, but that's they got them with a grant. There's a Terabag. I'm gonna ask Claire.
Yeah, will they let us?
Yeah. Yeah. I asked for 20 and they brought us like 4 giant boxes that I can't even store. I had to give them to the clinic manager. I was like, put these somewhere else. They were like, we got so many with a grant, we literally cannot get them out of the building. Which is sad. You know what? It may be them that also has the Terra bags.
They were in the same.
Yeah.
I think one thing on the whole we're going to have to figure out is once we get going, how we can staff it and how we support it. I can understand if it's nursing, goes with them. If it's wastewater, they go with. But do we want our
Wastewater will be the
going every day with that, not doing anything back at the office to keep our waiting that at night? I guess I forgot that, so we're good nights. But how do we, if we start talking, twice a month or every week at certain facilities, that seems to be absolutely so.
That would be great.
A lot, yeah, it would be great. But I think what I'm trying to say is, I think the board would be supportive with a plan to go ahead and ensure that we have somebody to bring that. We want them to get it out there. If that means we need to get someone that can man it every day, that would.
That's why I think we need to talk about the volunteers potentially too, and maybe a volunteer driver that's good. If somebody's sick, there's not a whole lot of people who want to drive that.
I can figure it out. Everyone knows it's 2 foot longer than our pickup. It's the same way.
So I can drive it.
You ride that pickup, it's that much longer.
Really? Okay.
Yeah.
Since we have a little bit extra time here, I just wanted to throw out, do you, Karen, or think that we need a building manager? Somebody to take care of, to assure the maintenance, to keep track of the repair records, to hound the HVAC people.
That's Vicky's job. She's the office coordinator, and so that's what she's been doing.
Okay.
Yeah, she calls it.
Well, I need somebody who could be even a handyman.
Yeah.
Who could do this.
That's right.
Well, maybe the driver could be both. The driver and could do those sorts of things. Yeah, even then retired.
Yeah,
What's the rate? What's the rate?
I mean, I think volunteers would be good because we can.
I know our insurance will allow the driver.
They do. Yeah, we've already contacted them and they said yes.
We could probably find some volunteer drivers.
Just like the nurses that volunteered during the pandemic, they were covered on our insurance as well, because they're true volunteers.
But I don't think we need a building manager.
I think she'd be able to find some volunteers, but I said that I would help if the whole unit's out and
We have an outdoor volunteer.
in there.
Yeah, I mean, absolutely. If I'm on the board or not on the board,
Yeah.
if you need a driver, call me. I mean, it doesn't scare me at all. Now, when I get down there, I'm gonna go over and sit on the lawn chair and have a coat. But
I could see some of the overpopulation wanting to maybe go out and just visit with the community members, and I think they would be excited to be part of the whole project.
Yeah.
To drive.
The greeter.
And visit with our staff, and I think
Everybody loves the greeter.
For our community to get involved.
I mean, there's no special licenses required.
Yeah, regular standard driver's license.
And it will drive very well.
All right.
It is not a cheap unit.
Well, we do have people that we call for, if we have plumbing problems, we've already got plumbers set up, we've got electricians and stuff. Again, that's what Vicky does, and I kind of partner with her on that too, so I don't see the need to spend the money for staff. I think we're doing okay. We don't have a whole lot of repairs that need to be done, but on occasion, we seem to find people that are able to do that.
So I'll get going through my wish list.
Well, in less time than budgeted, that's notable. Yeah, we did. Yeah.
I'm hoping now, should we set these up at like one?
Maybe quarterly?
We'll take one of these three and discuss it a little bit in our board meeting.
Or like make it a rotating agenda item?
Yeah, just one, there's three.
Like next month, we definitely want to hear an update on the construction, and then the month after that is mobile unit.
So yeah, next month would be construction, following up would be our mobile unit, that is, and next month would be.
But some of these things are already in place. Donna will be giving us an update on outreach.
Yeah.
The architects come every month, so we can badger them.
I don't know yes. I love the persistence. But I think it's more for like us to check in that we've met the marks of being on top of it. Like, has Connor done the things that we said we needed done? Or where are we? Are we stagnating? What resources are needed? Yeah. Not putting it on Connor.
Yeah. I think that's all important for us to understand a little more what's going on around that.
Mm-hmm.
And how we're, and we put in and say, well, we're getting a 17% click rate. I think Connor coming and speaking about it.
Yeah, will give us the context. They sure didn't go over click rate in medical schools generally. Professional training.
At least the next meeting is.
I think you can decide. Maybe it's the architect for the next meeting, because I think that's the most.
But we want to hear from you. We're excited.
But I think, definitely, his write-up next month, I think, would tell us kind of where we're heading. Or maybe the one after that would be a little bit more in depth of what's going on. I just think once a quarter, I think if you think about it, Karen, we have the departmental reports. And we're kind of on the way now from reading every one of them, and just we read them.
In our own time.
Yeah, and maybe there's a time twice a year where they come in and give us an actual presentation, more and above. But we don't need to, we've taken some of that time and carved out now, we could do other things. You get what I'm saying?
So you're saying a quarterly update on these priorities?
Yes.
Okay. But a monthly update from architects.
Yes.
Well, I'm saying we don't do them all in one meeting either when we do it. So we don't get all three in one meeting.
But by the end of the quarter,
Right.
we better have checked those boxes of checking in on the things that we prioritize.
Do you want to cover that under the last, within the item before? Comments and questions?
Yeah.
I think just leave it.
And I think we need more of an update than just quarterly from the architect.
Well, no, he said monthly. Yeah. It's just we're holding ourselves accountable on a quarterly basis to make sure we've moved the marker. Yeah.
And I do agree, I think that would be in business. I mean, that's.
Yeah, it's ongoing. Yeah.
Process.
It's in that session.
Yeah. Is that okay?
Before it actually moves into variable business.
Continuous business.
I've tried to keep up with that bigger construction update too.
I mean, do you hear anything from them?
Yeah, the lessons have been on the flooring and the furniture. I know we're trying to coordinate that because we're trying to make it.
What is
Some facility movement.
Yeah.
wrong?
Yeah. I know he was still working with the city, so it's getting very close to trying to come to a conclusion of whatever we needed to do.
Very close to something different to everyone.
Yeah.
Define your terms.
Okay.
I mean, what I'm afraid of is on that deal, and they need to be aware of this. On April 17th, the whole project could be dead because we haven't approved it or signed any contracts. And I'm not saying try to push it through by then.
But it might not be a whole new one.
It might not be. I'm not, I don't know.
Well,
There'll be two. There'll be two.
But there might be four.
There might be four. But again, the issue is that in fairness to that group, I don't want to dump that on that group. No.
Right.
And in all honesty, if they came in at that time, I'd want them to spend 3 or 4 months trying to understand it. Does that make sense?
Yeah.
No? I mean, I want to be fair to them. It's a big out in the ground.
Yes.
So, I mean, we are reaching a critical mass right now. Maybe that would be the best push to behind our day.
Yep. We have concerns.
We're coming in April, and if you don't get off the dime.
I mean, that's a fair statement to make to them. I would not have a problem with you making that statement to them. I mean, it's not
If you're not putting it right now, you will be.
It's factual, right?
Yeah.
You might hear more before that, I can do it right now.
Yeah, I mean, there's 7 candidates, so, I mean, even, they both argue that even, you don't know. I mean, this isn't it's not like we're on the TV every day.
They had to pull it on.
Yeah.
What's something else? How do you deal with that? Like, I see, Christy all the time. She gets on with from Lisa D.
Oh.
With, yeah, but she gets in with, what's his name? There's, he a Nissan guy.
Oh, yeah.
He walks all the way. He's always on that, and they always have different community groups. How do we get to do that community group?
I saw where the CIP is advertising, something to advertise your business. I did see that, just like in 2 different.
This is something that I don't know who pays for that, because he uses his business, and I don't know if he's using it as a write-off by bringing it in, and I think he's paying. How do we get to be his site? Yeah, but Christy does it. With Lisa D.
Oh.
Yeah, I saw her, but I did see her on the side of it.
She's always on the show.
Well, but that's different because of the connection between them and Bill Riley. Bill Riley leased the these.
Yeah, well.
And same thing with.
He always has community people every day. It's
I think most of them are not for profit.
tonight.
I don't know either, but I know.
And non-governmental.
John,
Yeah.
is it John?
This is where I'm trying to, even if we just get started.
Is it John? Yeah.
Right.
And he lost a ton of weight at surgery. Because I looked it up.
So just as an example, I went on Christian County Health Department on our website. All right, we can figure this out. See if I can get back to it here. On Facebook, I'm sorry. So I went Christian County Health Department. And just started reading through the comments. Get back to it. But basically, there was somebody on there saying, what a joke. They raised their rates from a health or food permit from X to Y, and then if you're day late, it doubles that. See if I can find it. Yeah, it says, Christian County Health Department is a joke, but I would expect nothing less with the county board and the health board. The board has approved raising restaurant permit fees from $350 to $450.
I don't know if it was one of these, or they haven't been raised, but.
And this application is rated $675. Talk about needing to drain the swamp.
I don't think we have a link to that, I don't think that's
I
fair.
believe that,
One
Christian
time
County and the
that
different
we
states.
need to be,
It's actually,
every one of those comments needs to have that.
I saw that earlier.
Christian County, Illinois.
okay, so that's what I was gonna say.
How do we solve that?
The outreach specialist put we're sorry to hear you're dissatisfied. Please reach out to you so that we can further resolve this.
No, what this is, it's because when you put in Christian County Health Board,
It comes up.
Oh, yeah, they paid for, yeah.
we're certain.
Okay, I thought you meant how do you address concerns like that, and I was like, no. Well, yeah, and
Now, people were very supportive of the health department, sure.
yeah.
But
Good on you, Christian County of Illinois.
it was Illinois.
Yeah. Maybe with outreach we'll hopefully not have those comments or have, wouldn't you be able to pay some for like a geo sense of some sort of, like if you're in Southwest Missouri, probably don't bring up Kentucky or Illinois first.
I'm not 100% sure about paying to talk in one side. In my report that I mentioned, getting it moving
It's
toward more numbers, deeper details. I mentioned trying to implement better SEO, and that's going to be a big part of it.
Yeah.
Because SEO practices, like one of the revisions that we've made to our website, for example, is if you wanted to access one of our environmental pages, it was just showing up as the wrong name because of the SEO in the back end.
Well, and then on the county website, there's just like a Christian County Health Department, like Christian County, Missouri, and it's just like Christian County Health Department, there's blank. So I don't know how we get them to redirect to our own run site, but that's how that was. Yeah, because I went to go refresh myself on the vision and mission statement before the meeting, and I was like, did we just hire a kid to make this better? Where is it? And then I quickly realized, I was like, well, this, I think it's from the county commission, their website, and it lists us, but there's nothing. It was totally blank. I don't know if I still have it.
Sometimes the mobile was different than other ones.
Well, and that's true too. It was a mobile. My son keeps opening 800 by this toy game.
Are you going to make enough more emails?
Well, I've got 12 more tabs to put. So yes.
On our site?
Yeah, I was on the website, I was looking at the mobile phone, just after hours yesterday, but I just not moving, I couldn't, like, move around on the page. So, anyway, we're just trying to stuff on and see what it looks like, just to make sure. So so many of those different settings on the phone space.
But yeah, basically SEO is making sure that if you type our name in, we show up first.
Well, now that we've been talking about it, it did show up first, but the one that's under it is just, yeah.
Oh, yeah?
And it's Ron Whitaker.
Oh, there you go.
Yeah.
Yeah. That's great.
Yeah, because I'm looking here, are you looking under the?
Yeah, no, I'm looking under the county commission's website. They have hours of operation and holiday schedule for 2023. That's not been updated. They don't have our lunch on the hours of operations, and there's no other, redirect.
Is the lunch anything that could be staggered where they would not have to close?
We have so much limited staff and even worse when people call in. I know in the past they tried to keep it open and they tried to stagger the hours to work and people come in early and some late, but it's not easy to do. We're doing a more people now by doing it because there's one person at the front desk and that person goes in sick and we're expected to be open and nobody's going to get lunch. So it's hard. And we don't take breaks during the day. That's why the hour lunch break. So even if we did stagger it, if we went on a 30-minute lunch break, we might be able to make that work, but then we're going to have to offer breaks in the morning and afternoon. We don't do that now. So it's just a little complicated.
I think our survey will help us understand.
Yeah.
Yeah, I mean,
I don't think they know.
if we can,
So
if we can hire more people to cover the shift. So
the reason I noticed people don't know and didn't do it in springtime is I had a project that I had where the merchants had to take a city bus and they had to go to these different places. And they had to schedule it themselves. And the health department was one of the one that I always said the one on the west side, the one that springtime is open all the time. But they had to go to the west side one because that was the one that offered a specific service. I knew they were close to themselves when students got stuck out there.
Yes.
And they couldn't make it because they would go out, they'd take their appointment, they'd go out and they'd have to sit there.
And then that delayed anything else they had that day.
yeah.
Or they'd have to give up and try again.
Well, that's everybody's trained on vital records or identical those kind of things. So that all kind of, you have to have multiple people here at the right time to make it work. Yeah, so.
Did you intern anywhere when you were in school?
With KSMU.
With who?
The radio station.
Oh, really? So did you go to Missouri State? So can we get an intern to help you next year in the summer? Yeah,
I do know people.
Well, it would be interesting if they offer an intern. And same thing with nurses. Would we do well?
Well, once our nurses are fully trained and comfortable, yeah, but right now it's a hindrance to them. So it would be their choice.
The program that I run is they're already nurses. So that's easier than the pre-licensure.
Yeah. Is it a paid intern or is it
unpaid?
Unpaid, yeah. So I would hope, same thing with some of those may be different ways.
But you have to have the time for our staff to invest in that person as well. So again, we're not at a point where we want to give them a good experience whenever they come, and if we're running around like our heads we don't really stretching around.
You have to have the body.
It's not a good experience.
Especially with continuity.
Yeah.
Is there any flexibility on the time that they go to lunch? Maybe leaving lunch hours open and going from 1 to 2? Would that cause riots?
I don't know what you're asking.
Walgreens does their lunch break because it's mandated now, so they close for 30 minutes, but they close at 1:30 to 2, so that it's non-peak business hours for.
Oh, yeah, I don't think they would mind I mean, I don't think it'd be a problem if it's more than 2 or something like that, or a lot of them do 12.
Maybe that's one of those what-if questions, like, to allow our staff a break during the day, we need to provide them some time to eat their meal. Would it be easier for you to have the health department closed 12 to 1, 1 to 2, 11 to 12?
Yeah, I mean, my suggestion on that would be to try to put seasons in 2 late nights, 2 Tuesdays a month. And so those people actually come in at 10:30, they already have to take their lunch from 12 to 1. And then they're given 6:30, so if you did something like that, I would suggest the later lunch, 1 to 2, something like that.
Do you have any data on business patterns throughout the day, like how Google's, you go and look at and then they're like, it's not busy right now, and then you go and it's a disaster, but, do we have any sort of foot traffic data? Yeah, I know. I mean, they may be accurate on the average, if that makes sense, but yeah, I'm never
I think it
in the middle of them.
Because we have multiple services, we can offer one thing, so I mean, we have to take walk-ins too as our synagogue, so again, we've got to take a lot of hours, because when we put something there, we have to let people know in advance too.
Yeah. Yeah.
Right. Closed door. I could see her come in and say, hey, I was talking to the front desk staff, if we could split those. Maybe that's the hardest.
We don't have nursing until 1 o'clock, but if you'd like to wait.
The door's not locked. It's not locked.
We have to hire an extra person at the front, because that front person not only greets the person and maybe running file records and my answers front. So now we're also having to do identical. So again, are you going to shoot yourself in the foot by having your business?
Well, can you set Identigo hours? Like, they take walk-ins, but that's at their own risk. If we're not offering.
Yeah. We have our hours set, but if we don't do so many hours during the day,
they lose you.
Yeah.
Okay. And we already are closed a smaller amount of time than other more businesses.
Because of our lack of staff.
Yeah.
Fighting with
Identigo, yeah, because we haven't had staff turnover, illnesses, and
we are over our hour and a half, by the way.
We haven't seen it in any 2 months because provided that in February we're going to open up full staff, but we haven't shut it down because we weren't making anybody happy. You can only do so much with 2 or 3 people without them the same minimum too, because nobody else works.
And the half an hour lunch, even if we provided the 15-minute break, it's easier to schedule on. Yeah, okay, they're only gone for 15 minutes. If somebody has to wait 15 minutes, it's easier to wait 15 minutes than a closed building.
Yeah.
And then if you have somebody gone during that lunch, and I don't know. I'm willing to do whatever you want, but
we wouldn't be the first place that put a sign up that says sorry, closed due to lack of staffing. Just offer it when you can.
They're not able to go anywhere else unless somebody lets them through.
Right.
So, we can put a sign up there.
I would say that so if lunches are interrupted, it violates the employee right to that lunch break. You'd have to offer it again. So if you ding it, it has to be a 30-minute uninterrupted break.
yeah.
Well, you said leave a.
If people come in the front door, it's not like they can wander.
Yeah. I mean that's possible if we wanted to put a we'll be back soon.
We'll be with you as soon as possible.
But we actually had to call the police on a guy that we told when I worked at Target and closed for a 30-minute lunch break, and when we told him that, he took shampoo from the end cap and doused our computers in it. Well, it ruined our signature pads, and those are $1,200 a piece, and that was a federal crime. Vandalism. Nephew went to jail for head and shouldering the Target pharmacy. Yeah, they persecuted him, or prosecuted him, close maybe. But he wasn't super mentally stable, but
yeah, I think maybe to check in with the staff that are here again, because we don't want to lose people because they're being overworked or.
we may be surprised if we ask for feedback from the staff staff may appreciate a little bit more flexibility in there.
I could see this evening, great.
Yeah.
You're not going out, what do you do for an hour?
Oh. Watch TV in my car and enjoy the silence because it's the only time I get it.
You done?
Adjourned. Sorry. 2:56. What's on the clock?